2013 marks the 10th anniversary of the creation of Canadian Friends of Hopital Schweitzer. This landmark allows us time to reflect and look back at our roots, and most importantly, not to forget who inspired us and how we became such an impactful organization. Our original inspiration is and always will be the lives of Dr. and Mrs. Mellon, who set the example of caring for the Haitian people of the Artibonite Valley with the motto Reverence for Life, or Reverence pour la vie in Creole. A representative phrase of the philosophy of Dr. Albert Schweitzer, a physician, musician, philosopher, and medical missionary. In the Peace Garden at the hospital, Dr. Schweitzer's words are inscribed in a plaque that reads, "You are not able to change the world, but you are able to give hope to one human being." This message would guide Canadian Friends throughout the journey of improving life of the Artibonite Valley. The formation of Canadian Friends of Hopital Albert Schweitzer was the result of a group of volunteers involved with the HAS in different capacities. In the 1980s and 90s, a number of Hamiltonians would visit HAS and help the hospitals in various ways. For example, Dr. Everett Sargent, who in 1985 was Hamilton's first doctor at HAS to serve as chief of surgery, and he motivated the urgent care obstetrics program. Dr. Sargent believed in the value of the matrons, or birthing attendants, who delivered prenatal and postnatal care to women in Haiti. Canadian Friends of Hopital Albert Schweitzer's focus continues to support maternal and child care programs. Dr. Sargent's wife Arlene introduced disinfectants to the wards and worked with the housekeeping staff to imitate Western sanitation standards. Eventually, Arlene Sargent would sit on the board of CFHAS when their first meeting occurred in April 2003. Another Hamiltonian, Debbie Berquist, has been involved with Hopital Albert Schweitzer for over 2 decades, first as a nurse, then head nurse, and eventually as joint CEO of the hospital. Brad Berquist was inspired by Sister Debbie's work and would come to live in Haiti with his wife for 6 months and acted as financial officer of the hospital. Peter Johnson was co-CEO of the hospital in 2003 and 2004. Peter, who acted as head administrator at the former Henderson Hospital for 31 years, realized that there could be room for a charitable office in Canada. The interest was confirmed by Hal Devens and Dave Shuttleworth, who had gained a passion for HAS through numerous visits to the hospital. At the end of 2003, just a few weeks following Peter's critical email inquiring if there was interest in forming a group in Hamilton, the first board meeting was held, which included Brad Berquist, Hal Devens, Kathy Johnson, David Shuttleworth, Mark Scoose, Roy Sheldrick, and Arlene Sargent. Since CFHAS's inception, many work teams have been organized to venture to the hospital and lend a hand. Some of the work team's projects include writing policy and procedures, visiting the malnutrition ward and interacting with the children, replacing broken wheels, casters for beds, cribs and gurneys, painting, cleaning and electrical work. Another team cleaned and painted houses in Lascaux, the tuberculosis village which later became homes for earthquake victims. The birthing kit program, led by Kathy Johnson, continues to improve infant mortality rates. An important outcome of sending the work teams is to inspire new volunteers to help the hospital and recognize the potential that exists in Haiti. Work teams have provided essential relief and awareness throughout the years and continue to inspire those who visit Hopital Albert Schweitzer. The hospital cares for 345,000 people in the area and typically receives more than 100 outpatients each day. Half of the hospital's inpatients are children. HAS also supports 4 outlying dispensaries, mobile clinics in the valley and up in the mountains. Every dollar you donate helps inoculate and provide medical care for malnourished infants and children, helps provide education on how to avoid diseases like cholera, helps to deliver invaluable pre- and postnatal care, and gives hope to the people of Haiti. In the 10 years as a charitable foundation, Canadian Friends of HAS has grown and expanded, and with your continued support, we will have raised over $1 million for the hospital by the end of 2013. If you're able to make a donation, CFHAS and the Haitian people will truly appreciate your kindness.